Morning, everybody. Morning, everybody, and welcome to Washington on a nice 20 degrees warmer than normal day. And for those of us normally from the upper Midwest, it's a nice, refreshing sort of walk over here to see the flowers in bloom and so forth. It was just really pleasant. I'm Dr. George Isham. I'm one of your co-chairs. I'm the senior advisor now at Health Partners in Minneapolis, and just really excited to be here to see all of you. Culmination of a lot of planning and commitment on people's part in order to get this started. Can you hear me in the back? You know, the more interesting your ringtone, the more quick you ought to be in terms of being able to get to it. So, can you hear me in the back? Because I'm kind of soft-spoken, I guess, these days. So, as co-chair of the Institute of Medicine Roundtable on Population Health Improvement, I'd like to welcome you all to today's workshop. And I want to let everybody know that this meeting is being recorded and webcast. So, if you're thinking about doing something outrageous, keep that in mind. I also welcome those of you who will be joining us on the web. We are extremely pleased to be able to convene this first meeting of the Roundtable. The Roundtable provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in social and political environment for achieving better population health. So this Roundtable's mission is to, one, explore and support the diffusion of best practices and the translation of research findings into practical solutions and policies. So explore and support the diffusion of best practices and the translation of research findings into practical solutions and policies. And then secondly, to facilitate dialogue, and dialogue is important, and catalyze collaborative action needed to improve health. And over the course of today, we will get clear in our minds, for those of you who are members of the Roundtable, exactly what the opportunities are for a Roundtable, so that we know what tools are at our disposal to achieve our purpose. So we'll discuss challenges facing population health practice, facilitate cross-sector collaboration and research, and identify approaches to promote population health improvement through mechanisms and partnerships within and between the public and private sectors. As one of our major activities, the Roundtable will sponsor workshops for members and the public to discuss issues of importance to improving the nation's health. As you know, today's workshop will highlight a range of perspectives on improving population health, research, governmental public health, healthcare delivery, and business. So I'm personally very, very excited for a number of reasons. One, I think the time is right for this conversation. I think the right people are in the room. And I think the opportunities are there. And so I hope you are as excited as I am about doing this. Secondly, I'm very personally excited to have the opportunity to work with my colleague and longtime friend and teacher and mentor, Dr. David Kindig, in co-chairing this. It's a real pleasure to be able to work with David and getting this going. And so I'm going to turn to him for a couple of comments at this point.
Well, thanks, George. I'm Dave Kindig from the University of Wisconsin School of Medicine and Public Health, and it is a real pleasure and excitement to be here. We've been George and I and IOM staff, who you meet in a minute, we've been working on pulling this together for 2 years, but and actually my wife said, "Are you nervous?" And I said, no, I'm not nervous, but there's a feeling of sort of there's an awe or a responsibility or some gravitas about sort of what we might be about here. So I actually approach it with that sense. Some of you know I started my professional career in an OEO neighborhood health center in the South Bronx. I helped set up the National Service Corps in 1971 and a lot of things since then. I am so tired of looking at these maps that I've been looking at since that time of not only how we compare to other countries, and we'll hear more about that this morning, but the disparities we have here. And so many people on this roundtable and here at the IOM have contributed to our understanding, current understanding of what the problem is. But this is an action. This is an action activity. And so I'm feeling excited about the 3 years of the human capital we have in this room and the resources that our sponsors have provided to sort of try to do something about it and move the metrics. And that's an awesome challenge, but I'm up for it. So.